Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Aisha binti Azuddin and I'm from Hayat 1HC2. So today I will be discuss about the female fertility problem, which is for the assignment biology 2, Sem 1. Okay, so we will be discuss about the female fertility problems, diagnosis for the problems, the causes of the problems, how we can treat using the clinical treatment, and also alternative treatment. So we'll go one by one. So first, the female fertility problem. So female fertility problem has many types of problems, but I only focus on one type of problem, which is the blockage of the fallopian tubes. So fallopian tube function is to connect the ovaries and the uterus so that the fertilized eggs can be implanted in the uterus. But if the person has blockage in the fallopian tube, the symptoms are not easily discoverable. Okay, if there is blockage in the fallopian tubes, the fertilized egg cannot be implanted in the uterus, so pregnancy may not occur. So this is how, if there is blockage in the fallopian tube will look like. Okay, second part is the diagnosis. How we can diagnose the blockage. So we can use the hysterosalpingogram HSG method. It is actually an X-ray procedure. So how it is done is that a cannula is placed into the opening of the cervix. Then the doctor will gently fill the uterus with a liquid containing iodine through the cannula. So there will be a contrast. The contrast will show the contour of the uterus. So this is the example of the X-ray diagram. We can see the cannula. So this is the normal fallopian tube. There will be no spillage here, but if there is problem with the fallopian tube, there may be spill here. Okay. Next is the causes of the blockage of the fallopian tube. So I will only discuss 4 causes. So firstly is the pelvic infection disease or PID. So it is actually the infection on the female reproductive organ. So it is caused by the bacterial infection that was transmitted from the vagina to the uterus, fallopian tubes, and also ovaries. So it may cause inflammation at the reproductive organ. So as we can see here in the diagram, so this is how the inflammation will look like. So the uterus will be inflamed, the ovary will be inflamed, and also the fallopian tube also will be inflamed. Okay, next is endometriosis. Endometriosis is when the tissue like the lining of the uterus starts to grow outside it, which means that it will grow at the ovaries and also fallopian tubes. So this tissue cannot be discharged from the body. So if that happens, cysts may form if the endometriosis occur at the ovaries. So this is how endometriosis looks like. There will be the tissue-like lining occur here, and also here. Okay. Next is the fibroids. So fibroids is actually the abnormal growth developed in the uterus that are usually benign or non-cancerous. So fibroids is made up of muscles and also fibrous tissue. So this is how the fibroids looks like. It will form at unexpected places such as the uterus. Okay. Next is the sexual transmitted infection or called STI. So for example, syphilis, hepatitis B, HIV, and also etc. So this STI may spread widely by the sexual contact, but also can be spread by non-sexual, for example, blood transfusion. Okay. So the blockage of the fallopian tube can be treated by using clinical treatment. Okay, so how? We can use the laparoscopy method. So how it is done is that the surgeon only will do small incision, and it is actually a low risk procedure. So the surgeon will use a laparoscope. Okay, but if the fallopian tubes are severely damaged, so the tube will be need to be removed completely. Okay. So this is how the surgeon will do the surgery. Okay, we can see the monitor. So the surgeon will use the laparoscope to see the inside of the organ. So she can do the surgery. Okay, from the monitor. So next is if the patient also can do alternative treatment. So how? So the patient can do acupuncture. So acupuncture is actually a traditional Chinese method. So how it is done? the acupuncturist will insert very small thin needles into the specific points of the patient's body so that it will stimulate the blood flow of that area. Okay, so the acupuncture, so this is how the acupuncture is done. Okay, only a small needle will be inserted at the certain point of the body. So, in conclusion, the female fertility problems can be treated. So patient need to know their problems and so that they can do treatment easily and quickly. Okay, so that is all from me. I shall be Azuddin. Thank you.